Diwrnod Rhyngwladol y Menywod 2026.
Roedd na anrheg Nadolig ychwanegol o dan y goeden eleni i'r teulu Thompson wrth i'r babi Lenny gyrraedd, ac yn un ar 10 wythnos oed mae'n anrheg nad oedd ei fam Kirsten erioed wedi meddwl y bydden i gael.
So since I was about 12, I've always had chronic pain and a lot of discomfort. And I was told over the years, over and over, that there was nothing wrong with me and nothing could be helped. And then I had a very bad episode with pain and ended up in A&E. And then I was referred to Dr Treharne, who then helped me get my life back on track, get rid of all my pain and the discomfort, and just be able to look after my kids and be happy.
I Kirsten, roedd y gwasanaeth iechyd menywod yn amhrisiadwy o ran darparu'r gofal a'r cymorth angenrheidiol iddi. Mae Hywel Dda bellach wedi agor canolfan iechyd menywod yn Aberystwyth, sef canolbwynt Breunari cyn i 6 canolfan iechyd menywod arall agor eleni.
What we're aiming to do with having the hub, so the primary care should be able to offer greater care to women and then be referred into the hub, which should reduce long waiting times. And that philosophy, we think, is about women getting the right care in the right place first time.
O fis Ebrill ymlaen bydd menywod ar draws Hywel Dda yn dechrau derbyn gofal sy'n gysylltiedig a chynllun iechyd menywod Cymru mewn lleoliad sy'n agos atynt.
Ar y funud gallith patients cael ei referio gan y GP i ddod i'r hwb, ond dyn ni'n gobeithio o fewn amser bydd yr cleifion gallu referio eu hunan i'r mwyn dod i'r clinic.
So there's 8 key priorities from the Women's Health Plan, and what the government have asked us to concentrate really on this year is menopause care, menstrual health and contraception. So we've been upskilling our primary cares practitioners in the menstrual health, in contraception care and in menopause care. And really what that means for women is they should be able to access their GP or be referred from the GP into their cluster, the Women's Health Hub cluster, for that level of care. They for any menopause, menstrual health care, contraception care. If the GP themselves can't do it in the practice, they can refer them into the hub. And we'd expect that to be up and running by April.
Mae menywod ar draws y byd heddi yn dathlu diwrnod Rhyngwladol y Menywod, ac i Kirsten a Lenny mae'r gwaith a wneir gan y tîm yng Ngheredigion wedi rhoi rheswm iddynt ddathlu hefyd.
I was told for years and years that I couldn't have any more children after my first 2, who I didn't naturally conceive. And he's the reason that I have him today. With having severe PCOS, I was told that the scarring was too bad, that I would never be able to have kids and my pain wouldn't get any better. But then I saw Dr Treharne and he tried new treatments that no one else offered or suggested. And then a year later, we have this new little one.
Am fwy o wybodaeth, ewch i biphddd.gig.cymru/iechyd-menywod.